Hmm.
What is this? Why is this going on?
Gee. Hello, folks. Nice to see you. Hi, Dolores. Hi, Amber. How you doing? And Lana. Nice to see you. And hello again, Dolores from YouTube. And Kay, very nice to see you. Well, so Khanna's bill has now come out, and I guess it's time to review it. So I'm going to start by sharing Common Dreams article about it, which we'll go through. And I do want to provide a little context, I guess, before I go through it. So things have been moving a little slowly with respect to the Medicare for All bill, as far as we can tell. we have a situation where not much has been done as far as we know about Medicare for All. There may be things going on behind the scenes in the committees, but things seem very, very quiet because Biden has been involved in trying to get bipartisan support. So first he worked with the Republican representative, Shelley Moore Capito. And of course, she and he produced absolutely nothing in their negotiations. They were too far apart. Now Biden has decided to waste even more time by now talking to a special group of centrist people. You know who they are: Mitt Romney, Lisa Murkowski, Joe Manchin, and a few other unnamed people, to see if they can hammer out a compromise with the president that he would find acceptable. Of course, the Republican counteroffers so far have been ridiculous because whatever the headline offer says, they reappropriate all but something like $200 billion from appropriations that have already been made. So what they're trying to do is to cut previous appropriations that haven't been spent, not keep them available to be spent, and only put another $250 billion into the economy. Now, Joe Biden proposed to put $2.2 trillion into the economy. So, of course, he's a little testy about people who who want to make sure the economy stays in a state of secular stagnation because they want to defeat the Democrats in 2022 and Joe Biden in 2024. So, of course, he didn't come to an agreement on that. And now he's hoping that the centrist people from both parties can produce a better offer that he can accede to through regular order. Why does he want to go through regular order? And why does he want to have bipartisanship? Because he thinks he can get votes because he's bipartisan. He thinks he can get more votes because he's bipartisan than he can if he gets results for people. That's the problem. In fact, he doesn't want to get results for people. So he knows if he doesn't get results for people, he's got to have something going for him to do fairly well in 2022 and 2024. So he hopes to be able to claim, well, he was bipartisan, and he hopes that people give a crap about that, which, as we know, they really do not. They really, really do not. I mean, after all, Barack Obama was compromising with the Republicans all the time. What did it get him? Got him fiscal cliffs and cuts and the slowest recovery in history. That's what it got him. But nevertheless, there's Biden playing out the Obama administration, starting out fast with the bill people needed. Of course, it wasn't even that fast because he went through reconciliation this time, so he didn't get a bill passed at the end of January. He had to wait till March 15th, but still, it was a big bill, far bigger than anything Obama had passed, and he really liked that. You have the problem again.
I'm trying.
Well, okay, so he's already gone through the first part of June now. He's given himself a deadline to finish negotiations with the Republicans by Memorial Day. He's already at June 9th, and now he's starting on a new round of negotiations. because he doesn't want to produce real results by 51-50, all Democrats. So there we are. So we're going to see this now. I don't know if it's going to be another week or another 2 weeks, okay, or whatever. I don't know whether he'll come up with a bill, but he seems to have, okay, or some of the Democrats anyway, seem to think that they ought to go ahead with a budget resolution so they can pass a reconciliation bill sometime, hopefully before the end of the fiscal year, just in case Biden doesn't come upon an agreement with the Republicans. Even if he does, even if they pass a vote that overcomes a filibuster for an infrastructure bill, then there are Democrats who would like to pass a reconciliation bill anyway before the end of the year to cover things that the Republicans and Democrats couldn't agree upon. So that's a plan that's kind of in the background here. And this is part of the background of what's been going on with respect to Medicare for All, because, of course, since they're all preoccupied with this, they're not doing very much when it comes to Medicare for All. But there are some hearings scheduled. We should be hearing about those hearings soon. And there's a big Medicare for All protest event coming up on July 24th. Jayapal is trying to coordinate essentially movement activity and lobby organization activity with the activity in Congress to get a big push for Medicare for All over the summer in hopes of getting enough support to get 60 votes for it in order to break a filibuster, or maybe get enough support that would actually be support for getting into the reconciliation bill that they're talking about. Though I think the chances of that happening, okay, are very low. So I think Pramila and Ro Khanna have worked out a strategy which they employed in the last term of Congress too, the last session of Congress. And that plan was they would come in with a main bill for national Medicare for all, and then Ro Khanna would introduce a bill which Jayapal would co-sponsor, and that would be for charting out a state-based path to Medicare for all. So this is that bill for the 117th Congress. This is the bill that's supposed to back up H.R. 1976 in case H.R. 1976 doesn't get through Congress. Now, I'm not sure why they think if they can't get H.R. 1976 through Congress, why they think they can get this new bill by Roe through Congress. But maybe everybody can create enough pressure that the Biden administration would feel they had to do something for the Medicare for all people. And maybe they would give us Ro Khanna's bill as a consolation prize. In this case, it would be a very, very good consolation prize because it would really provide a chance for those states where the Medicare for All movement is strong to pass a state-based bill that would provide universal health care at a very, very low cost to people, that would demonstrate that this is feasible across the country at the state level, and then possibly might cause a stampede to Medicare for All in the same way one had a very quick movement to the Canadian version, okay, of Medicare in the period 1965 to 1970. So that's the thinking behind this. And now let's get into some of the details. I have been sharing some of the Common Dreams articles on this. Common Dreams has changed its interface somewhat, so it looks a little different. Khanna introduces bill allowing states to carve path toward Medicare for all. It's by Kenny Stansel, their staff writer, June 8th, 2021. See, the new format gives them the chance to show pictures of their staff writers. Congressman Khanna received praise from lawmakers who are progressives and Medicare for All advocates on Tuesday after reintroducing a bill that would provide states with access to the federal funding and regulatory flexibility needed to implement the universal health care programs. Quote, if the last year proved anything, it is that universal health coverage is not optional, it's urgent, unquote. The California Democrat, a member of the Congressional Progressive Caucus, said in a statement. The proponents of the new legislation say it would advance the national movement for a single-payer system on a state-by-state basis, especially as the effort at the federal level has been stymied by the Biden administration's vocal opposition to supplanting the nation's for-profit system. As Khanna's office explained, the state-based Universal Health Care Act, and there's a link to a PDF, which is the PDF that gives you the act. Let's make sure it's the same one that I have. This would create a waiver to allow states to develop their own plans to provide access to health care for all their residents via access to federal funding streams and regulations flexible enough to support affordable universal health care plans. In order to apply for the waiver, participating states or groups of states must propose plans to provide health care coverage for 95% of their residents within 5 years. After that time, participating states would be required to demonstrate they reach coverage targets and provide a plan to cover the remaining 5% of their population. States that do not reach the 95% target after 5 years would have to revise their plan to achieve the targets or risk losing their waiver. And then they'd have to go back to the Affordable Care Act, normal Affordable Care Act. Federal technical assistance would be made available for states seeking help in developing and implementing these plans. In addition, the bill, quote, requires benefits provided under state plans to be equal to or greater than what federal beneficiaries receive now, unquote. If a state's proposal is deemed acceptable after being evaluated by an independent panel of healthcare experts, the Secretary of Health and Human Services would then approve or reject the waiver application. According to Khanna, quote, this is precisely how bold states like California can take the lead in making Medicare for all a reality. While longtime Medicare for All advocates, including National Nurses United, the Labor Campaign for Single Payer, and Social Security Works have endorsed Khanna's bill, expanding Medicare is not the only route to universal coverage outlined in the state-based Universal Health Care Act. Khanna's office noted that, quote, states will have the freedom to devise their own individual state-based universal health care programs as long as they meet the coverage and depth requirements. The legislation identifies a variety of possible funding and regulatory avenues that states can take, including health benefit exchanges, cost sharing reductions under the Affordable Care Act, premium tax credit, and employer mandate under the Affordable Care Act, also Medicare, Medicaid, CHIP, FEHBP, that's the Federal Employees Program, TRICARE, and ERISA preemption provision. Notice there's no preemption provision here for the VA. There's no preemption provision for Indian healthcare. Khanna's attempt to forge ahead with universal health care at the state level is co-sponsored by Democratic reps Earl Blumenauer of Oregon, Suzanne Bonamici of Oregon, Jamal Bowman, New York, Peter DeFazio, Oregon, Mike Doyle, Pennsylvania, Chuy Garcia, Illinois, Raul Grijalva, Arizona, Eleanor Holmes Norton of D.C., Jared Huffman of California, Pramila Jayapal of Washington, Mondaire Jones of New York, Barbara Lee of California, Andy Levin of Michigan, Joe Neguse of Colorado, Ilhan Omar of Minnesota, Shelley Pingree of Maine, Mark Pocan of Wisconsin, Ayanna Presley of Massachusetts, Jamie Raskin of Maryland, Jan Schakowsky of Illinois, Adam Smith of Washington, Mike Thompson, California, Rashida Tlaib of Michigan, and Barney Watson Coleman. Notably absent from that list, I note, the article did not note, but I note, Alexandria Ocasio-Cortez, also Marie Newman, also Cori Bush, also Debbie Dingell. You wonder where those stalwarts are. Ro Khanna tweeted after one of the U.S.'s deadliest years, 2.7 million Californians are still uninsured. We know Medicare for all is the only future for healthcare. We know Medicare for all is the only future for healthcare. Proud to reintroduce my state-based Universal Healthcare Act. So every state has the power plus funding to provide universal coverage. 2.7 million uninsured, says there for California. The bill elicited praise from many progressives, including Egan Kemp, Public Citizens Healthcare Policy Advocate. Even before the pandemic, states like California and New York were leading the way in working to create state-based single-payer healthcare systems that would ensure that everyone in the state has access to the care they need, Kemp said in a statement, quote, "The COVID-19 crisis has only increased the groundswell for state and federal tax and federal action to fix our broken healthcare system by breaking down barriers to care and eliminating the ability of greedy corporations to profit off illness and disease." Quote, again, states should be given the authority and funds to create more efficient and equitable single-payer systems to demonstrate just how much better they are than our fragmented for-profit healthcare systems, unquote. And then Kemp added, quote, "This bill would do just that," unquote. Last week, Medicare for All advocates debated the merits and drawbacks of sub-federal efforts like Khanna's in a pair of Common Dreams op-eds. On the one hand, Dr. Anna Malinow, past president of Physicians for National Health Program, and Kate Tillow, coordinator of the All Unions Committee for Single-Payer Healthcare, argued there's no evidence that successful state-based reforms will be widely adopted nationwide. In fact, they wrote, the danger exists that if healthcare is left to the states, the U.S. will become a nation of 50 different healthcare tiers at war with each other over federal dollars. Yes, there's a danger of that. There's also a danger that those states that actually got Medicare for all systems would attract people from other states to come there and live and work so they could have access to the Medicare for all system, leading to perhaps depopulation of states that don't go for a Medicare for all system. This might create some tensions within the union, uh, kind of a reverse drain to what we saw when lots of industry moved south during the 1960s and 1970s, because the social programs down south were underdeveloped, and the industries, of course, were trying to cut costs. So they migrated the factories south for a while before they migrated them completely out of the country. So you had that drain of population from some of the Midwestern and Eastern states going south. Now maybe some people will come back because Medicare for all is available in some of the northern states. Nobody has made that point, but there it is. Anyway, with Khanna's bill, it was argued, by Melanow and Tillow, that we are about to see a similar balkanization of Medicare, the one national program that guarantees health care to everyone over the age of 65. I personally worry about that. I wouldn't like to see that. So we're going to go over Khanna's bill and see whether that's a danger if Khanna's bill is passed. By failing to establish, quote, single payer as the model to achieve universal health care, Khanna's bill opens the door for states to go the way of the Affordable Care Act, a mishmash of employer and individual mandates, greater expansion of Medicaid, and more generous subsidies for the exchanges. The pair wrote, adding that this would end Medicare as we know it. Writing in response, Philip Caper, a physician and founding member of the National Academy of Social Insurance, agreed with Melanow and Tillow that a uniform national program or improved Medicare for all would be the best way to go on the grounds of simplicity, efficiency, effectiveness, and political sustainability. He might have added, and a lot lower cost. However, he added, I see no evidence that the Congress, as it is now constituted, has any appetite to enact anything close to improved national Medicare for all on national scale anytime soon, unquote. Noting that, quote, there are ongoing efforts in over 20 states to enact universal health care, unquote. Caper wrote that the idea of state-level universal health care, despite its shortcomings, is a powerful and compelling tool for education and for organizing the power of the people that will be absolutely necessary to overcome the power of the medical industrial complex. A good argument, I think. Caper's perspective was shared by Jayapal, who in March introduced the Medicare for All Act of 2021, and who was also a co-sponsor of Khanna's state-based Universal Health Care Act. Jayapal is quoted, as we continue building the movement inside Congress to pass Medicare for all nationwide, we must also support states that stand ready to provide health care for all of their residents while ensuring they have the resources to do so, unquote. By the way, that is a quotation that was welcomed very, very happily by the whole Washington movement and the Red Berets, in Washington, who were quoting that all over the place, from Jayapal as support, from Jayapal for the state-based initiative they're pushing in Washington. There was something else that happened but there today that I will get into somewhat later. But right now I want to end the article. I think that's it. Yep, that is it. And move on to Ro Khanna. Oh, that's just the same thing again. Okay. So there were links, in the announcement on Ro Khanna's website to the bill and also links to a summary of the bill. So I'm going to now share a summary of the bill. Section by section summary of the bill. Short. Bill can be referred to as the, quote, state-based Universal Health Care Act of 2021 and describes the purpose of the bill as providing flexibility for states to offer comprehensive universal health care coverage to all residents in a single state. Section 2, waiver for state universal health care, creates a new waiver in the Affordable Care Act with a provision that allows states to combine several federal health care funding streams if the state offers a comprehensive but universal health care plan that guarantees all residents of their states are covered. To be eligible for this waiver, states would have to provide a detailed description as to what the proposed state action would be for enacting a comprehensive universal healthcare plan and provide an implementation plan for meeting the requirements of the waiver. Implementation plans would have to show how states would provide access to health care for 95% of their residents. After 5 years, participating states would be required to demonstrate they reached these targets. Well, we've gone through that already in the Common Dreams article. The bill makes clear that the benefits provided by states have to be equal or greater than what beneficiaries receive now. An independent assessment panel made up of healthcare experts and officials would evaluate for the Secretary of Health and Human Services whether a particular state's proposal meets the requirement of providing as much or more coverage than the individual streams. Okay. Now we have to look at the exact wording, but from the summary, this seems to suggest that an assessment panel would be evaluating whether, for example, in the case of Medicare for All, the state version for people over 65 was an improvement over the national Medicare for All program. If it was not an improvement, i.e., did not produce any more benefits for people over 65, then presumably the proposal of the state would not meet the requirement of providing as much or more coverage than at least this one individual stream, the individual stream, of Medicare for All funding. Finally, the state would have to provide an assurance that it has the legal authority to implement its health care plan. In order to combine streams of funding, provide flexibility, and allow for states to offer comprehensive universal health care, provisions in law that are waived pursuant to this bill include: 1, the requirements for the establishment, creation, and maintenance of health benefit exchanges. That would be waived. That would go. No more exchanges. Cost-sharing reductions under the Affordable Care Act. That would go. 3, premium tax credits and employer mandates under the Affordable Care Act. That would go. For Medicare, that would go, and the revenue stream would come into the state instead for other things. 5, same is true for Medicaid. 6, CHIP. 7, the federal employees' health benefit plan. That's kind of interesting. The federal employees' health benefit plan would then be provided by the state and not by the federal government any longer for federal employees working in that state. I personally find that a bit strange. Then there's TRICARE, which is for the families, of veterans. That would become a state-based program also, and the revenues that would normally go to TRICARE would go to the state. And 9, an ERISA preemption provision, so that the regulations, of ERISA would not apply within states that had this waiver, that got a waiver to produce a universal healthcare coverage system. Then there's waiver consideration and transparency. In the summary, not later than 6 months after enactment, HHS will issue regulations that provide for public but notification and comment, a process for the waiver application process, and reporting on the implementation and evaluation process. The HHS Secretary will provide Congress an annual report on the applications received and programs conducted through the waivers that were granted. A regional waiver request allows 2 or more states the option of submitting a waiver application together. For example, California, Oregon, and Washington could band together and submit a waiver application together. This would produce a pool of something like 52 or 53 million people in that particular patient pool. That's bigger than many, many, many other nations have in their healthcare pool. Granting of waivers underscores that state coverage, among other things, would be no less and cost no more than what residents would have received under the federal program, provide coverage and cost-sharing protections against excessive out-of-pocket spending, and include all state residents, including DACA recipients, but exempts from these requirements those eligible for benefits through the Indian Health Service, the VA, and military treatment facilities. So this bill isn't going to touch those things. Coordination between HHS, Treasury, Office of Personnel Management, Defense, and Labor is required through an interagency memorandum of understanding to ensure that all regulations are administered to have the same effect absent a waiver. Then there are definitions. The terms health benefit coverage, resident, secretary, and specified federal health program are defined in the Act. So that's the summary sheet. So let's stop sharing that. And let's now go right to the detailed bill and look at that, see if we say anything different or anything questionable. I better share that for you, or you won't be able to see anything. And you'll have to rely only on my exposition, and you won't be able to see what's in this, the language of the real bill. Starts to amend Title I of the Patient Protection and Affordable Care Act. There we go. To authorize the establishment of and provide support for state-based by universal healthcare systems that provide comprehensive health benefits to state residents and for other purposes. In the House of Representatives, Mr. Khanna introduced the following bill, which was referred to the Committee on, and there's no committee assignment as yet, so we can't tell you what that is. To amend Title I of the Patient Protection and Affordable Care Act to authorize the establishment of and provide support for state-based universal healthcare systems that provide comprehensive health benefits to state residents and for other purposes, be it enacted by the Senate and House of Representatives of the United States of America is assembled, and then it goes on, short title, and so on. And then it gets to the language, and it says, the purpose of this act is to establish a flexible framework under which states can provide comprehensive but universal health coverage to their residents. Section 2, waiver for state by universal health care. A, in general, subtitle D of Title I of the Patient Protection Affordable Care Act is amended by inserting after Section 1334 the following new section, Section 1335. Waiver for state by universal health care. A, application. 1, in general. Subjects to state may apply to the Secretary for the waiver of so much of the requirements described in paragraph 2 with respect to health benefits coverage within the state for plan years beginning on or after January 1st, 2022, as is necessary to implement a comprehensive state by universal health care plan in the state under this section. Such application shall A, be filed at such times and in such manner as the Secretary may require, contains such information as the Secretary may require, including a comprehensive description of the state legislation or other state legal authority as applicable, and program to implement a plan meeting the requirements for a waiver under this section. Item II, a plan for how the state will achieve in 5 years health coverage for at least 95% of residents of the state. And III, a 10-year fiscal year budget plan for such plan that is budget neutral for the federal government. And I don't know how the state is going to make it budget neutral for the federal government. Exactly, I think the federal government will have to, or Congress will have to propose some budget plan that is, budget neutral. Why Khanna felt it necessary to place that in the bill, I don't know. I think what Khanna should have said, a 10-year fiscal year budget plan for such plan that will be paid for by trillion-dollar coins as necessary to cover the cost of the state plans. The trillion-dollar platinum coins, of course, is what I favor. And C, provide an assurance that the state has legal authority to implement such plan or has enacted the law described in subsection B2. Okay. So the state has to pass the law and then go to the federal government, right? Okay. Requirements. The requirements described in this paragraph with respect to health benefits coverage within the state for plan years beginning on or after January 2022 are as follows. I should point out here that what Roe is doing is hoping for quick passage of this over the summer or right at the beginning of the new fiscal year. Certain states having plans ready, having laws ready, pass these laws, start coverage on January 1st, 2022, or as soon after that as practical. So almost immediately. Very, very responsive in that respect. Sections 1301 through 1324, A, sections 1301 through 1324, B, section 1402, C, sections 36B and 49H of the Internal Revenue Code of 1986, D, Title 11 of the Social Security Act, E, Title 18 of the Social Security Act, F, Title 19 of the Social Security Act, G, Title 21 of the Social Security Act, H, Chapter 89 of Title 5 of the United States Code, I, Chapter 55 of Title 10 of the United States Code, including coverage under the TRICARE program, J, Section 514 of the Employee Retirement Income Security Act, of 1974. 3, pass-through of funding with respect to a state waiver under paragraph 1, under which the state assumes responsibility for health coverage under one or more of the specified federal health programs, including under each of the federal health care or subsidy programs specified in subparagraphs A, B, C, D, E, F, G, H, and I of paragraph 2. The Secretary shall not spend federal health or related administrative funds that would otherwise have been spent for such a program as applicable for the time periods covered under the waiver, shall provide for an alternative means by which the aggregate amount of such funds determined by the Secretary in coordination with the state, including caseload growth, adjusted for inflation and healthcare costs within the state, shall be paid to the state for purposes of implementing the state plan under the waiver. Any savings in healthcare spending, including administrative savings, shall be available to the state for reinvestment in healthcare services under the state plan. Such amount shall be determined annually by the Secretary, taking into account the amount that would otherwise have been spent under each federal health program, including for administrative activities and caseload growth with respect to residents of such state for those time periods covered under the waiver, adjusted for inflation and healthcare costs if such waiver did not apply. Such amount shall include funds equal to the aggregate amount of premium tax credits, cost-sharing reductions, or small business credits to the extent applicable to an approved waiver under Sections 36B and 45R of the Internal Revenue Code of 1986 or under Section 1402 that would have been available to individuals and businesses in the states for those time periods covered under the waiver, including caseload growth adjusted for inflation, healthcare costs if such waiver did not apply. For waiver consideration, waiver consideration and transparency, yes. In general, an application for a waiver under this section shall be considered by the Secretary after taking into account by recommendations of the panel under subsection G in accordance with the regulations described in subparagraph B. It's legislation, of course. There is all kinds of stuff like this. Not later than 180 days after the date of the enactment of the state-based by Universal Healthcare Act of 2021, the Secretary shall promulgate regulations relating to waivers under this section that provide I. A process for public notice and comment in accordance with the public notice and comment by requirements applicable under regulations used for Medicare waivers pursuant to Section 1115 of the Social Security Act. Process for the submission of an application that ensures a disclosure of I. The provisions of law that the state involved seeks to waive. And 2. The specific plans of the state to ensure that the waiver will be in compliance with subsection B. 3. A process for providing public notice and comment after the application is received by the Secretary that is sufficient to ensure a meaningful level of public input that does not impose requirements that are in addition to or duplicative of requirements imposed under Chapter 5 of Title 5 United States Code. I'm going to go on with this technical stuff here, and when I come to a significant part, I will then go back to reading and commenting on that for you. 5, a regional waiver request and plan. Nothing in this section shall be construed to prevent 2 or more states in a region from submitting a single application under this section for a waiver that establishes a plan that is applicable to all the states included in such an application. So, coordination with 1332 waivers. A state may not apply for a waiver under this section with respect to a plan year if such state has in effect with respect to such plan year a waiver under section 1332. So that's a limitation. There is authorized to be appropriated such sums as may be necessary for providing funds to states with a waiver under this section for purposes of carrying out activities described in subsection B1E. And on the granting of waivers, the Secretary shall grant a request for a waiver under subsection A1 if the Secretary determines that the state plan A will provide, in accordance with subparagraph B, health benefits coverage to applicable state residents that is at least as comprehensive as the health benefits coverage that such residents would have received under one or more of the specified federal health programs as defined in subsection I4 as applicable for which such residents would have been eligible absent such a waiver. B will provide in the case of such a waiver under subsection A1 for the state to waive any requirements described in subsection A2F is applicable health benefits coverage to applicable state residents who would have otherwise received health benefits coverage in the form of medical assistance under the state federal health program described in section I4B. I'm going to skip some more of this because it doesn't seem to be saying anything different from the summary as yet, and I think we're looking for differences from the summary. There's the bit about exempting individuals eligible for benefits through the Indian Health Service. That's not being wrapped in here. And the same is true for the VA. H will provide assistance for complaints, appeals, independent review, and other procedures for accessing and maintaining benefits that are at least as accessible to applicable state residents as those of one or more of the specified federal health programs for which such residents would have otherwise been eligible without application of such waiver under subsection A1. So this lingo seems to be providing essentially safeguards. So the new health care coverage plan, okay, any state does not provide any worse benefits than the current federal plans would under the Affordable Care Act. So that seems to be good and seems to suggest that the intent is certainly not to give the states complete freedom to move funds away from Medicare for all recipients to other recipients, or to use other means of downgrading the quality, okay, of Medicare for all. We have to note, though, whether that really happens or not in the implementation will depend on the assessment panels and what they decide concerning whether a waiver will be given to a state. You have to wonder whether, if the assessment panels were to function under a Republican administration, whether the appointees of such panels would rigorously enforce, okay, the requirement that the services to seniors and to other members of the community would not be degraded by these state plans. I still think that this is a danger. But going further, we're nearly halfway through the act. Okay, at this point, I don't see anything that is not in the summary in this particular language. assuring coordination. Not later than 180 days after the date of the enactment of the state-based Universal Health Care Act of 2021, Secretary of Health and Human Services, Secretary of Treasury, Secretary of Defense, Secretary of Labor, and the Director of the Office of Personnel Management shall, through the execution of an interagency memorandum of understanding among such secretaries and director, develop a process for coordinating and consolidating the state waiver processes applicable under the provisions of this section and the existing waiver processes applicable under Titles 11, 18, 19, and 21 of the Social Security Act, and any other federal law relating to the provision of healthcare items or services. So this is for coordination, essentially interagency coordination, to avoid conflicts under the bill between agencies. There's a provision for submission of conforming amendments in order to preclude any possible conflicts. Section G is about an independent assessment panel for comprehensive health care. That's obviously very important. One establishment, there is established a committee to be known as the Independent Assessment Panel for Comprehensive Health Care, in this section referred to as the panel. The Secretary shall forward a copy of each waiver application submitted under this section to the panel for consideration under this subsection. Okay, then it says the panel shall review any waiver application by a state no later than 90 days after submission of such application by the state, provide to the state and to the Secretary the recommendations of the panel regarding the approval or disapproval of such waiver application, or regarding the status of the waiver for continuation pursuant to subsection E2, and if applicable, possible improvements to such application, or for purposes of subsection E2, and C, submit to Congress an annual report on waiver applications and waiver reports under subsection E, reviewed by the panel during the applicable year, including a number of applications. I still don't see anything different from the summary. Do you? The panel shall consist of 11 members appointed by the Secretary of Health and Human Services, of whom no one shall be appointed on the recommendation of the Speaker of the House of Representatives. One shall be appointed on the recommendation of the Minority Leader of the House of Representatives. One shall be appointed on the recommendation of the Majority Leader of the Senate. One shall be appointed on the recommendation of the Minority Leader of the Senate. One shall be appointed on the recommendation of the Republican Governors Association. One shall be appointed on the recommendation of the Democratic Governors Association. One shall be a representative from the patient advocacy community. Two shall be representatives of a labor organization representing healthcare professionals who provide direct patient care, including at least one labor organization that primarily represents registered nurses. 9, one shall be a representative of primary care physicians. One shall be a representative of healthcare professionals practicing in rural or underserved areas. So they're trying to make this panel a representative panel. Each member shall serve a 3-year term. A member may serve after the expiration of the member's term till a successor has been appointed pursuant to subparagraph A. Vacancy. Any member appointed to fill a vacancy occurring before the expiration of the term for which the member's predecessor was appointed shall be appointed only for the remainder of that term. A vacancy in the commission shall be filled in the manner in which the original appointment was made. Pay. Members of the panel should serve without pay. That should provide an incentive for them to serve, right? Chairperson, vice person. Chairperson. Secretary of Health and Human Services or a designee of the Secretary shall serve on the panel as the chairperson of the panel. Vice chairperson, the administrator of FEMA or a designee of the administrator shall serve on the panel as the vice chairperson of the panel. Staff experts and consultants. The panel may appoint such staff as the panel considers to be appropriate without regard to provisions of Title V of the United States Code governing appointments in the competitive service. B. Fix the pay of such staff without regard to the provisions of Chapter 51 and Subchapter 3 of Chapter 53 of such title relating to classification and general scheduled pay rates and C, procure the services of experts and consultants in accordance with the provision of Section 3109B of such title. 6, detail of federal personnel. Upon request of the panel, the head of any federal agency may detail on a reimbursable basis any of the personnel of the agency to the panel to assist it in carrying out the duties under paragraph 3. 7, the Federal Advisory Committee Act. The Federal Advisory Committee Act 5 USC Code Act shall apply to the panel. Authorization of appropriations, item 8, very important. There's authorized to be appropriated such sums as may be necessary to the panel for carrying out the duties of the panel for each of fiscal years 2022 through 2027. Then there's some guidance to American Indians and Alaskan natives. The Secretary shall issue guidance with respect to applying the provisions of this section in a manner consistent with the following: to further the goal that federal health services to maintain and improve the health of Indians are consonant with and required by the federal government's historical and unique legal relationship with and resulting responsibility to Indians. Section B, no enrollment fee, premium, or similar charge, and no deduction, co-payment, cost sharing, or similar charge is to be imposed against an Indian who is furnished an item or service through a waiver under this section. All costs incurred in waiving such charges shall be borne by the federal government in fulfillment of the trust responsibility. C, the state may not require the enrollment of an individual who is an Indian in health insurance offered through a waiver under this section. D, health insurance insurers offering coverage pursuant to a waiver under this section must make good faith efforts to contract with Indian healthcare providers operating within the area served by the issuers. Health insurance issuers offering coverage pursuant to a waiver under this section should pay Indian healthcare providers, whether such providers are participating or non-participating providers, with respect to the coverage for covered services provided to those Indian enrollees who are eligible to receive services from such providers at a rate equal to the rate negotiated between such entity and the provider involved, or such a rate has not been negotiated at a rate that is not less than the level and amount of payment which the entity would make for the services if the services were furnished by a participating provider which is not an Indian healthcare provider. Let's see if there's any more I need to read under here. G, the treatment of Indians under this section does not constitute invidious racial discrimination in violation of the Due Process Clause of the 5th or 14th Amendments, but is reasonable and rationally designed to further the health of Indians. Well, saying it so does not make it so, I'm afraid. I guess the courts will be the final judge of that. H, in the case of any state in which one or more Indian healthcare programs furnishes healthcare services, the state will provide for a process under which the state seeks advice on a regular, ongoing basis from designees of such Indian healthcare programs and urban Indian organizations on matters relating to the application of a waiver under this section that are likely to have a direct effect on such Indian healthcare programs. I'm going to skip over Then there are definitions. I don't see anything fishy in what we're going through. We're already at page 27 out of page 30. It defines citizen and alien and other definitions of this sort. It defines secretary. So that is nearly it. So it looks like the fate of services to Medicare is going to be up to the assessment panels. They're going to make the judgment as to whether in a state plan, the provision of the federal Medicare benefits are at least equal to and likely more generous than what would be currently provided under the Medicare program by the federal government alone. So I don't see anything that's not in the summary. I don't see any fast ones. Okay, I don't see any fine print. What I do see is that a lot of weight is placed on the assessment panels. They have to be panels that are really trying to serve the public interest. They have to be panels that are really serious about evaluating whether a state plan under this would really be an improvement over the services they would already be getting through the Affordable Care Act. And that's when there is an improvement in the state-based version, okay, of Medicare, that's when the waivers would be granted. So you put a lot of weight on these panels. And the question is, how would these panels survive under Trump or a Trump-like figure? I don't know. I think you can see this is a pretty simple bill. 30-page bills usually are. There's no particular wrinkle. There's no fine print. If the assessment panels are doing their job, then this kind of law should work to empower states to offer programs that have a chance of becoming universal health care coverage programs and that are a true improvement over the Affordable Care Act in the various states. So that's what I am seeing here. I am seeing nothing but an enablement for the states, for people to create such programs that go beyond what they are getting now from the federal government. I was surprised in reading the full details of the bill that the wording doesn't seem to preclude. In fact, it seems to mandate that Congress would have to authorize any costs that states would incur in the line of pursuing their plans. whether the costs that the states were to incur were not to be deficit neutral. In other words, what if deficit neutrality were breached? Well, there's a process for review of that and a process for the state to put in plans to hail such a breach, but there's no process to put a limit on that. I don't see that as a fault in this bill. I see it as a feature that would allow the federal government to spend as much as has to be spent to fund the state-based plans. And therefore, the way this bill is written seems to me to give states like Washington, Oregon, and California, Minnesota, and Pennsylvania, and so on, a reasonable financial push from the federal government in getting a Medicare for All program enacted in their states with a reasonable chance of success and not falling afoul of the financial problems. I'm going to show one more thing to you tonight. I'm not going to share this anymore. This is unplanned, but we seem to have time for it. So I am going to show you that if I can find the thread. Let me see if I can find threads. I think I can. I'm going to my Twitter stream now, trying to locate something that happened there today, which some of you may know about, but which was greeted with tremendous enthusiasm by the Red Berets in Washington and by the people in the whole Washington movement there. So let me see if I can find that again. I hadn't planned on covering that, but we have the opportunity, and it is worth covering. So Stephanie Kelton had been getting pressed by some of the whole Washington people and the Red Berets people to make a statement somehow endorsing or supporting or being in support of their efforts to have a state-based plan. Okay, and today Stephanie Kelton came forward, and what she said, okay, I'm getting near to trying to find her original tweet here if I can. I think it was retweeted to me, and I may be able to see it. Well, okay. Even if I can't see it, I can show you what she said. Yeah, go ahead. That's fine. So Stephanie Kelton tweeted, which you can, oh, wait a minute, I'll share this for you. So you'll be able to see it on my screen. Okay, so the background of this is there had been conflicts really since May 30th between some MMT folks, okay, and the Washington folks, because the MMT people were warning Washington folks that they might run into financial trouble if they tried to pass this bill. And Washington were successful, okay, at passing it, okay, because the state of Washington is not a monetary sovereign. And there were other MMT people including MMT people who were part of the whole Washington movement and part of the Red Berets, who had been saying, well, just because Washington is a monetary sovereign does not mean that it won't be successful in pursuing, a Medicare for All bill. So Stephanie was pressed by the Red Berets and by Scott, there's Neuer, I guess, or DeNoyer, I'm not sure how he pronounces his name. And so she replied to them and to 20 others and said, I think H/C, healthcare, that is, should be a right of all people. I think coverage should be federally funded and leave no one out. I think it is possible, though harder, to cover folks at the state level, even though states aren't currency issuers. And she said, I respect slash admire those fighting on both the fronts. And she presented the fisted hand of solidarity to the Washingtonians who were asking for her comments. I replied and said, thanks, Steph. I was pretty sure that's exactly what you thought, but it's good to see you say it. And I copied a bunch of people, including some of you. Now, let's see if I screwed that up. There was also a reaction from the Red Berets themselves, from Laura Fielding, who was the head of the Red Berets. Let me see if I can find that thread in an easier way. Nope. Didn't do it. Okay. Must be back here. Nope. Still didn't get it. All right, here it is. So Laura Fielding tweeted, she tweeted a photo of Stephanie saying exactly what that tweet actually said. And you can see the meme that she created from that. I said I couldn't agree more. Pass it in the states that have movements, and there will be a groundswell of demand. Pass it in New York, Massachusetts, Vermont, and Pennsylvania, and the whole Eastern Seaboard down through North Carolina will have it in a few years. I believe that's true. There are some caveats, specifically if you look very carefully at that. One friend of mine tells me correctly, actually very correctly. Of course, all this created quite a stir and lots of positive feedback from the Washington folks. Okay, but my friend pointed out to me correctly very correctly, that what actually Stephanie did not commit to any method here. She did not commit to Medicare for all at the state level as the method that should be enacted. She stated that she thought healthcare should be a right of all people, and she thought that coverage should be federally funded and should leave no one out. And the motto of Medicare for All, by the way, is everybody in, but nobody out. That's one of the slogans, okay, of Medicare for All. But it's also true that that same slogan could be applied to other methods as well, other than Medicare for All. For example, it could be applied to the analog of a national health service, a Washington Health Service, that would totally socialize healthcare, okay, in Washington. Okay, there's also another method, okay, that could be used, which was based on community healthcare practices, where the states would focus on primary and community healthcare being very, very plentiful and covering all people, okay, at no cost, and then making on the theory that if people are being checked out very frequently by primary doctors, okay, and general practitioners of one kind or another, that it will be possible to catch very serious illnesses at an early stage, so that there would be great savings of money, so inexpensive health care that was not actually through a Medicare system, but could be provided to folks in a state. So she says, I think it's possible, though harder to cover folks at the state level, even though states are not currency issuers. She says, I respect/admire those fighting on both fronts, on the national front and on the state level front. But the takeaway here is that she hasn't really committed to a Medicare for All system. She hasn't really committed to the whole Washington initiative, proposal, which is done through creation of a trust by the state to administer health care for all, and which has no copays, okay, no deductibles, okay, attached to it, but does have premiums. There are premiums in their plan. So in that way, it's unlike, okay, the national Medicare for All plan. And so in Washington, they're hedging their bet a bit by not covering completely all costs, but by using premiums to try to defray some of the costs for the state. Whether this would be necessary to do if whole Washington were to modify its proposal, okay, in accordance with Khanna's new bill, I don't know. That remains for future analysis. Okay, we have to look into that extremely carefully. We'd have to look at cost analysis of what whole Washington wants to do and how, okay, it wants to do it. The bottom line here again is that there was no commitment by Stephanie to the specific whole Washington plan as the proper plan for Washington. There was rather generalized support for state-based efforts, And there was support, I think, can be read into here, for the federal support for the state-based efforts. In the sentence, I think coverage should be federally funded and leaves no one out. So, at the state-based level, I don't believe that she would object to federal funding of the state-based efforts, either partially or fully, through something like the financial help that would come from the state-based act of Khanna, for states that wanted to implement a universal health care system. Okay, so that was received with tremendous enthusiasm by the whole Washington people. I've somehow lost the rest of that thread, other than my contribution to it, which is unfortunate. There are a lot of other people who really thought it was a tremendous achievement for the whole Washington people to get the implicit support at some substantial level from Stephanie Kelton, embodied in this particular statement. At this point, then, it seems like the conflicts that had been going on between some of the MMT group and some of the state-based effort group in Washington have now been moderated, and that a degree of solidarity has been achieved. Of course, discussions go on, but all this is hopeful, especially in the context of the review, I should say, in the context of the reintroduction of the state-based act for universal healthcare coverage from Ro Khanna. Okay, so that's what I have to say tonight. Okay, I hope you liked that. I hope it was informative for you. Hope it was worthwhile. I'll now go over your comments. Hopefully I'll have the whole comment stream today and won't have the problem I had last night. But who knows? One can never tell. It looks like the whole comment stream is here this time, so that's good. So Dolores Pierce says, hello, everyone. Kay says, hi, everybody. Glad to see you. Ghost Start says, shared at 9:05. Carmen Mina says, hiya, Hulk and friends. Lana says, hi, Richard. Ojeda calls her Shelly Crapito. Haha. Yeah. And Steve Gonza says, doctor testifies to Ohio lawmakers that vaccine magnetizes people. The vaccine magnetizes people? And then he says, Ohio ranks 32nd in education. Kay says, Biden is just screwing around, hoping he can blame the GOP for his mistakes. Well, that hope is not going to win the 2022 contests, okay, for Democrats. And if the Republicans get control of the House, okay, and the Senate, or even control of one of the branches, okay, of government, it's very likely that that Biden is going to have a very, very poor 2023, 2024. Okay, says Biden has not even fired Rump's heads of the Social Security Administration yet. Absolutely true. Steve Wolfbrand says at 9:16, hello, Doc. Hello, Steve. Kay says, I hear now the SSA is asking for more money. And Kay says, yes, we need it now. So sick of fighting with Medicaid here in Ohio. Carmen says, I can tell you right now, New North Korea, Florida, isn't going to take the Khanna plan. Well, maybe not. Maybe there'll be a rebellion in the New North Korea. Kay says, my internet keeps going down. Shake my head. Maybe it will be better on YouTube than it is on Facebook, Kay.
Who said that?
Kay.
About what you did, connecting it to machines.
Yeah, I don't think Kay can do that. She's going in on her phone, I believe. Evelina says, serves them right if they can provide adequate health care for their people. Well, if there were fair elections in Florida, then I would say it would serve them right. But Florida is highly gerrymandered, both on the federal level, okay, and internally to the state. It's rigged for Republican control, okay, of the legislature. So it's not all the people's fault. Of course, it was initially their fault for voting the Republicans in so they could rig. That's true. Lana says, the naysayers will squawk about the drain on Medicare for all the opposite way, though. They will say, look at all these people using our tax dollars just like they do with immigrants. Yes, they'll say that. But as you told me today, Lana, there was a statement in the Budget Committee of the House by the chairperson, Representative by Yarmouth of Kentucky, who called the attention of people to Stephanie Kelton's book and to the idea that we really don't have much to worry about when it comes to deficit spending anymore, and we don't have anything to worry about when it comes to the national debt or the debt to GDP ratio. And he sort of, he proudly imparted this knowledge to the current favored candidate for OMB director, Shalonda Brown. So, okay, and Shalonda Brown evidently grinningly agreed with the chairperson. So knowledge of Stephanie's book is beginning to spread inside of Congress beyond the small group of squad people who likely have read it. It's now been spreading to many other people in Congress, and in fact, the book is probably being read by many of the people in the Congressional Progressive Caucus and beyond, because I don't think John Yarmouth is a member of the Congressional Progressive Caucus, but I may be wrong about that. He hasn't been a very active member of the CPC, and he's definitely considered an establishment Democrat, but he does seem to be learning the basics of MMT from the deficit myth. So Evelina says people will relocate to states that offer it. I think they will. It's important enough to people that they will. Okay, now maybe other states will try to avoid a Medicare for all type plan, but they still might introduce a universal health care plan with cost controls on the providers so they can afford a pretty good health care plan in their states, even if it's not a Medicare for All plan. We have to keep in mind that in certain other countries, for example, Switzerland, okay, in Germany, in some other states of Europe, they have very, very good health plans at a fraction of the cost of our health plan. And the insurance companies are entirely private. There's no public option. The health providers are entirely private, okay, in those countries. But of course, they still have cost control. They've rigorously controlled the profits of the health insurance companies. They rigorously regulate them, and that has enabled them to bring costs down. Now, Germany and Switzerland are still two of the most expensive countries in which to get health care, apart from the United States. But they still deliver health care at two-thirds the cost taken as a percentage of GDP than we do. Now, some of the Medicare for All systems and the national health care systems go far lower than that. In other words, some of them it's 9% of GDP, 8% of GDP, 7% of GDP, even 6%, okay, of GDP, which is one-third of what it costs us. And by the way, we're rapidly approaching 20% of GDP here. I think that's forecast for 2022, okay, right at this point. And Evelyn announces the Dakota pipeline project has been canceled permanently. Great news. Yes, I read that too today, that the developer of the Keystone XL pipeline project has pulled the plug, has put to bed that project. That is a great victory for Native Americans and a great victory for people all through the Midwest. That project will not be destroying the aquifer in the Midwest of the United States. That is wonderful news. Kay points out New York is trying to pass single payer too now. Yeah, the word, though, is that it may be very difficult for them because a lot of the people in New York, in the legislature in New York, who claim to be for single payer, in fact, when push comes to shove, do not plan to vote for it. They've only been claiming to be for single payer because they wanted to avoid getting primaried. So this bill may fail in New York. But I guess there is supposed to be a vote in not too long a time. Evelyn says, why isn't AOC and other members of the squad signing on to this bill? Is there a reason for it? I haven't heard anything. I don't know. It may be nothing. It may be they just didn't sign as original co-sponsors because they were doing this or that, or, they weren't in Washington at the time of the introduction. It's hard to believe that AOC and Cori Bush and also Newman, okay, and Debbie Dingell aren't for this bill. Okay, Debbie Dingell had to go into the hospital because she had a terrible problem with her ulcers, and she still might be recuperating from that. So that may be the reason why she's not a co-sponsor yet. I'm almost certain the four people I've mentioned will soon be co-sponsors, okay, of the bill. So I think this is probably kind of a mechanical thing that they're not on the bill yet. But I expect them to be on the bill quickly. And other people too. I wouldn't be surprised if Rosa DeLauro gets on the bill. After all, she's the person who has been working for family care for years and years and years and decades. And what better for family care than Medicare for All? She should be all over this bill in support of it. and she may well be over the next few days. Carmen Muniz says state residents, will that include the homeless? Oftentimes, the homeless can't qualify for squat because they cannot prove a residency. I'm sure that if this is Washington, there will be provisions for the homeless in their bill, and that this will certainly be accepted at the state-based level. There's nothing in Ro Khanna's bill that bars that coverage. It's going to be up to the Washington bill. I haven't read through the whole of the initiative, but from Washington yet. But I'd be surprised if it doesn't include benefits for the homeless. Kay says, can't see your comment on Facebook, Evelina. Maybe Evelina made one of her comments on YouTube. I don't know. She seems to be making them on Facebook. So, Steve Gonza says, were no gagaboo tonight? And what's gagaboo? And Evelina says, Steve Gonza says, breaking, Maine is the first of the 50 U.S. states to divest its financial holdings from the fossil fuel industry. $17 billion will be shifted to clean energy in another major blow to Chevron. Citizens made this happen. We can do this. Also breaking, the Keystone XL oil pipeline has officially been abandoned by its developers. Organizing works. Kay says, SPAN has been working for it in Ohio for about 10 years now. Don't happen unless we get Dem leadership that is progressive here, and I'm not holding my breath on that. Kay says, I hate living in a red state. Ohio has always been a red state. And Steve says, Doc, do you think humans will last another century? I'm really starting to doubt it. Steve, I sure don't know. I sure don't know. I would not safely predict that. On the other hand, I won't predict that we won't last for another century. Either. I won't predict either. What I'll say is that it is up to us. We can get it done. Steve Gonza says, okay, back to the subject. Just in, White House Budget Office approves Biden administration plan to retract insulin, epinephrine, but discounts. You gotta be joking.
What?
You gotta be joking. What is he doing? Is he trying to pay Joe Manchin off? Didn't Joe Manchin's daughter have something to do with that? I don't know. But anyway, it is one of the things that will mark him as a president who was corrupt, and it will make people very, very angry. I mean, people have little tolerance for this bullshit now. Not just us. People, they see through this stuff, and people are going to be told. And Carmen says, the Satan, another name for DeSantis, is not going to let folks have state Medicare. He's using COVID recovery money that's supposed to go to affected communities to build seawall and raise roadways in South Miami that's getting ocean encroachment due to global warming. serving the rich. Well, I don't know what it says in the specific COVID bill that he's using to do this. In other words, what formal language in the bill is allowing him to shift money to this. But in the state-based plan, okay, of Khanna, that kind of thing is not going to be allowed. In other words, the state-based plan is going to have to prohibit that kind of shifting of funds, and the plan will have to provide only for spending on healthcare. Evelina says there will be a lot less of us, the survivors. Kay says, moving to North Carolina in 1995 when it was a blue state spoiled me. I immediately saw a huge difference in state policy. Kay says, sadly, Republicans have ruined that state too now. Steve Wolfbrand says, this too shall pass. We're just a moment in time. Unless we become interplanetary very quickly, we are toast. Well, if we are toast here, there are not going to be too many of us who are going to survive on the moon, okay, or on Mars, or on the moons of Jupiter and Saturn either. In other words, if we screw things up here, then our population is going to be severely reduced. Now, we got to go interstellar very quickly. Kay says, not seeing any comments except mine on Facebook now. Steve Wolfbrand says, I see you, Kay. Kay says, not seeing you, Evelina, anymore, Steve. Steve Gonzo says, no Medicare for all during a pandemic is all you need to know. Yeah, I know. That was astonishing. It's astonishing. Steve Gonzo says, happy birthday, Deficit Myth. 1 year old today. By the way, I reviewed the Deficit Myth soon after it came out. I have a 9-part series on that. You'll find it on YouTube in June of 2020. You'll find my 9-part review. 9 programs, 9 live streams on Stephanie's book, reading and commenting on the whole book. Go back and look at it. It's the most complete coverage of that book that exists right now. The most comprehensive coverage that exists right now. Evelina says, I sent her birthday wishes today. Kay Clark Ryan on YouTube. Kay says, I see you guys now. Yay. Oh, I see. Same thing happened to me the other day. It will come back. Still not seeing you, Evelina. Shake my head. FB sucks tonight. Steve says, I think we will shortly see very advanced breakthroughs in science, health, space exploration on many fronts. Finally, the realignment is starting. I hope so. But what we really need are advanced breakthroughs in removing carbon from the air and sequestering it in the ground quickly. We need very large engineering projects to be implemented and very large regenerative agricultural products to be implemented in order to do this and to stop global warming in the first place, to freeze it at 1.5 degrees centigrade. What?
Trees take too long to grow.
Yes, so we're probably going to have to do it with hemp. Kay says, thank you all for another great discussion. Love these, and you all too. Steve says, we love you as well. And I say, we love you also, Kay. And Kay says, lost other comments again. Shake my head. Sorry, Steve, lost you again. Steve says Peru has won a great victory. Um, FI is down there. Not sure, okay, what FI is. I'm aware of the Peruvian victory. It looks great. Let us keep our fingers crossed that the CIA is not able, that the CIA and the Biden administration is not able to overthrow the new government. And let us keep our fingers crossed, okay, that the new government is very aggressive in controlling the neoliberal fascists down there in Peru, because they are there just as they were in Bolivia, just as they are, okay, in Ecuador, just as they are, okay, in Chile. The pink tide is returning to the Andes region and to South America more generally. And that is wonderful, but this time they have to really disarm their foes. They have to strike at the basis of their power. Kay says if single payer gets the okay in California, might be a reason for people to move back there again. Might be. Kay says, I have grandchildren in California, and we have our daughter in California, and our daughter would love single payer in California.
Yeah.
Lana says, now line 3 in Minnesota needs to die. Yes, it does. Carmen says, at least in Germany, you can see a doctor in minutes, and your x-rays, prescriptions, and all other matters related to your injury or illness is usually handled in one facility, unless you have to be admitted to a specialized hospital for some reason. Just the stress of referrals and running around while you're not well is healing due to less stress and exertion. Yeah, Germany's plan is very good. They've had it for a very long time. And even though it is in private hands, they're so closely regulated by the government that it works well, and that, as I said, the costs are contained. It may be a bit more expensive than other systems by 1 or 2%, okay, of GDP, but it delivers very good care. Very good care. Switzerland does too, but it does cost $400 a month for people on a continuing basis. And I believe there are small copays too. But I don't recall that necessarily correctly.
Good night.
No, it's not quite time yet. I mean, it's actually it's time, but I still have a few others to go through that I must go through. Yeah, that was Carmen. Carmen says, "Be correction." Carmen says, "Joe, have you read or heard about the Reverend Barber and the Poor People's Campaign planning on protesting Mansion? Isn't that wonderful?" Yes, it is. Well, it is wonderful. And I think that they're going to have a big effect, okay, in West Virginia, because I think that there is latent support in West Virginia for Medicare for all. Now, West Virginia doesn't vote for Democrats anymore because the Democrats turned into neoliberals and no longer support programs for the people in West Virginia. But for years and years, every senator from West Virginia, Bob Byrd, Jay Rockefeller, supported a Medicare for All program. Jay Rockefeller went into 2009 supporting a Medicare for All program. Of course, he folded on that and became known as Jello J for that. But the point is, for years and years and years, since he first became senator, okay, in the 1970s. He was supporting Medicare for all, wanted Medicare for all, pushing Medicare for all. And Bob Byrd did too. That was because the people of West Virginia wanted Medicare for all. It was very popular with them. Joe Manchin was able to move away from it because the state was going to the Republican side. But it started going to the Republican side because the Democrats would never deliver for the West Virginians anymore. In spite of the fact that they had Democratic governors and Democratic senators for years and years, they got nothing for that support. Kay says, Biden is a corporate Dem. Sadly, we needed Bernie. Oh, yeah. I think Biden might be getting extorted or blackmailed. Carmen says space cadets ought to know what has been a year already since your review already. Time is flying. Kay says, I had many FB friends wish me a happy birthday. Very nice. Thank you, Kay. Thank you for telling us that. Carmen says, hantavirus is back. Steve says, Fauci declared he is science. To question him is to question science. Carmen says, CIA is going to bring American freedom to Brazil. Steve says, Fiorella Isabel is in Peru reporting. Yes, I know she is. I've seen her there a few times over a few days. She is very, very happy right now. Steve says, sounds quite Trumpery. Kay says, Harris really screwed up down in Guatemala. Shake my head. Yeah, she did. Carmen says, Germany has home doctor visits like back in yesteryears. Steve Wolfbrandt says, good night, everyone. Good night, Steve Wolfbrandt. Evelina says, Castillo is Peru's new president. Another bit of good news. Yes, that was terrific news. Carmen Yuna says, I wrote Peru. You wrote Peru? You wrote Peru? What did you write Peru about? Well, folks, it's 10:57. I'm going to say good night. Sleep tight. Happy dreams. I won't end that little refrain. Have a great night, folks. I'll see you tomorrow. Carmen said, no, you said Brazil. It was Peru. Gloria says, thank you and good night all. Evelina says, yes, happy dreams. Dream of Peru. That should be happy dreams. Kay says, night all, but love you. We love you, Kay. And Steve says, don't let the bed bugs bite. Had to finish it up, didn't you, Steve? Carmen says, night, Bonnie and Clyde. There's this one guy here who lives in this building. Every time he sees us, which is at least 5 times a week, as we're leaving the building, he says, it's Bonnie and Clyde. What banks are you going to rob today?
He says it every day.
He says it every day. He never tires of saying it. And Steve Wolfbrand says, Peru, yes. Peru, yes. Peru, C. Yankee, no. Carmen Muniz says, laugh out loud. Good night. Couldn't resist that. Good night, folks.